இதுல என்ன தெரியுது, இதுல எப்படி பார்த்தாலும் தெரியாது. என்ன வச்சாலும் தெரியாது.
Good morning, everyone. So now we come. Before we begin the proceedings, I request everyone to kindly raise one by one, please. It's my privilege to welcome you all to the National Student Conference on Emerging Roles of Pharmacists in Patient Care, organized by our institution. This occasion emphasizes the importance of drug safety and our collective responsibility in ensuring the well-being of the patients. We are truly honored to have among us our distinguished leaders, Mr. Vedapu Virus Wala and Mr. Milan, who has graciously accepted our invitation to deliver the guest lecture today.
Admit in speaker.
It's my privilege to welcome you all to the National Student Conference on Emerging Roles of Pharmacists in Patient Care, organized by our institution. This occasion emphasizes the importance of drug safety and our collective responsibility in ensuring the well-being of the patients. We are truly honored to have among us our distinguished guests, Mr. Vedapu Virus Wala and Mr. Milan, who has graciously accepted our invitation to deliver this lecture today. Now I only invite our respected Dean Ma'am, Dr. P. Moyan, to deliver the presidential address and share the words with the remarks. Thank you.
A very good morning to all. Good morning. Nice. So it's my pleasure to inaugurate and commence the national level guest lecture series and with respect to the conference associated with the Department of Pharmacy practice today. It's indeed a pleasure to have Venkat Shivara with us, Director, Richa Paramount Private Limited, Hyderabad. So it's an honor to have you here today in the national conference, and we are happy to present to you on all the expertise you have. We are really happy to have you here with us. At this juncture, I acknowledge my thanks for the management, registrar, and my fellow students and faculties for their kind-hearted cooperation and support throughout any conference we launched resulting from the teamwork. So I welcome you, sir, for this august gathering.
Regular, around the presentation. Hello. Ramchandra Reddy sir.
Now I request Mr. Ramachandra Reddy sir to give the brief introduction about his case.
Good morning, students. Good morning, and students. Welcome you to the national conference, first national conference of Department of Pharmacy Practice in this college. And also, I take this opportunity to welcome Mr. Mandala Venkata Shiva Rao, who is the subject speaker, who is going to talk to you on the subject of therapeutic role of probiotics in daily use. Because most of you know about probiotics, but what is more important is right is to know about each and every aspect of probiotic in a very short form. So Mandala Shiva Rao is a seasoned business development professional with over 29 years of experience in pharmaceuticals, handling senior roles in business administration, sales, marketing, and development. His expertise includes strategic planning, profit center operations, relationship management, sales promotion, distribution, and team leadership across multicultural environments. He is an MBA, he is a double MBA. His basic course was BA Economics. He has completed MBA in Finance and MBA in HR. At the same time, his key achievement were especially Best Business Manager in impact in Metal Dixon Diabetes Care. He has got a gold medal for Best Presentation, especially in POP. And he is a legend, especially legend of Pfizer Award. He has also got in Pfizer, very important award known as Legend of Pfizer Award for one of the best brand. So to start off with, especially, he has started his career. He is known to me also because he is a man who has started from humble beginnings, very humble beginnings. Especially, he is a highly talented guy, very humble beginnings. And in fact, I got a small role. I had a small role and opportunity in taking him for first employment. That is the way how we have got relationship with Mr. M.V. Shiva Rao. So he started his career from Pfizer as a professional service officer, and then he has got promoted as a district manager, then regional business manager South, and then as a branch manager South in Metal Dixon company. Later, he was promoted as general manager for a Tesla Life Sciences company, and during his, especially he has handled business of nothing less than 100 crores. He has handled business up to 100 crores to his tenure. He was very a simple man, humble, honest, and straightforward. So today, he has also worked in a company called as Unique Biotech as a business head and associate vice president, which has led formulations and grew from contract manufacturing in pharma. He is an expert in contract manufacturing in pharma, nutrition, export, and participation in various trade shows. Today, you will be surprised, Mr. Mandala Shiva Rao is a general manager. Actually, he is a managing director, especially for the Instrument Biolabs. He has grown from humble beginnings and has become a managing director of a pharmaceutical company, and is heading the operations independently, along with his full team. So that is his professional achievements at all weathering his caps. So thank you, sir, for accepting our invitation. Now we'll start sharing the slides. start the presentation. Sure. Okay. We start the presentation now.
Kindly wait the presentation. Good morning, everyone, and thank you so much for joining this session here today. There is really partnership Therapy benefits of probiotics. It's not just the usual good bacteria. To hear about and different aspects, it is specific that doctors and pharmacists use like medicines to treat manage and even treat such diseases. Let's dive into it. Go for it. Slide two. This is the interaction therapy probiotics. Therapy probiotics are specially chosen and tested strains that use in microbiome. We give them an exact doses to help with specific health problems. They are different from the regular probiotics because they are used as actual treatment tools. The most important thing to remember is that they work in 5 main ways inside our body. Next, go to the slide please. So that's a mechanism reduction. Here, you can see 5 key ways that help us. They are complete with the bad bacteria. How they work is the competitive inhibition. Competitive inhibition is a factor that will be the mode of action how these probiotics work. They compete with the bad bacteria and take them out of the gut. They produce their own natural antimicrobial compounds that kill harmful microbes. The important thing to remember is that there are 5 main ways inside the body. These are, you can see the 5 key ways that they can help us. They compete with bad bacteria and kick them out of the gut. They produce their own natural antimicrobial compounds that kill harmful bacteria. They make the intestinal wall stronger so toxins cannot get immediately. They balance the immune system by controlling KLR signals and cytokines. Nothing much you know about KLR signals and cytokines being harmful. They produce helpful metabolites like short chain fatty acids that reduce inflammation everywhere in the body. And finally, they bring with this stuff that bacteria back to normal after antibiotics or illness. Sir, can you go to slide number 3, please? This is the therapeutic mechanism. Here you can see 5 key ways to help us understanding how they act. These probiotics completely bacteria in the mouth of the cat. And ingest into your they produce their own natural antimicrobial compounds and it is a harmful microbiome. They make the intestinal wall stronger so that toxins cannot leak into the blood. The balance of the immune system by controlling signals and cytokines. They produce helpful metabolites like short chain fatty acids. And another way to reduce the inflammation in our body. And finally, they bring the disturbed gut bacteria back into normal. When you use antibiotics, usually these probiotics will get washed out from the system. When you are in an illness, so this problem will be there. So you are these kind of probiotics will help us to reclaim the dysbiosis into eubiosis. Dysbiosis is nothing but the death of food bacteria in our entire digestive system. When that is there, probably it will get all kind of diseases. That's what intestinal diseases. And so many applications are there for this probiotic bacteria. The main intestine was stronger, so the toxins cannot leak into the blood. That is a major benefit by using these probiotics, which is not very good kind of bacteria. Usually they are not positive. The balance, our immune system, they balance by using these probiotics, how the immune system will get balanced by controlling PLR signals and cytokines. That's what I already told you. And these probiotics produce helpful metabolites like short chain fatty acids, and they are going to reduce the inflammation in our body. That is the way how the disturbance that after using these kind of probiotics come into normalcy, that is eubiosis. These are the mechanisms that are recent for probiotics and that can be used in many different conditions. Now let's see them in action, starting with the go for this slide for gastrointestinal applications, especially irritable bowel syndrome. Go to the slide number 4. This we have already discussed 2 times. Gastrointestinal application, the first thing is IBS, you know again about irritable bowel syndrome. The first success story is irritable bowel syndrome or IBS. The best pain fever, lactobacillus, plantarum, Bifidobacterium bronchum, and Saccharomyces boulardii. What do they do? If you ask me, they reduce the extra sensitivity data, repair leaky gut lining, and even change how the brain feels pain sickness coming from it. They reduce the extra sensitivity of the gut by repairing the leaky gut lining, and even change how the brain feels pain sickness coming from the intestine. In practice, usually we give 350 billion CHU, colony forming units, every day. The exact number depends on strain, but at least 8 to 12 units. The students, the results are impressive because the patients will get around 40 to 60% of less abdominal pain, much less bloating and gas, and talking about IBS. What do? They reduce the extra sensitivity they can repair the leaky gut line. That is the main thing. Okay. Slide 5 is So it really improves our daily life when we have this, beautiful colors. In the file, side number 5 will have the gastrointestinal application only, but it is about irritable bowel. We cannot do experimentally bowel. Next one is Crohn's disease and ulcerative colitis. Here, probiotics are used as an extra support, along with the regular medicines. Not main job is to lower the flow inflammatory cytokines. You must know about TNF alpha, IL-6, and IL-8. Especially the probiotics like Solari. Most commonly used those three blocks 900 million public population. Only under the doctor's supervision. Patients can see lower inflammation in inflammatory markers even to last. Really complete inside in the soil. When you go to the side, you will have alternative physical applications like antibiotics, malaria. Which is a major part of just because bacterial infection. See that the causes very reality. Our most evidence is preventing and diarrhea, antibiotics. And you usually when you go to the doctor, usually they do the empirical analysis before going for dialysis. So really they start with some antibiotics, some decomplex stuff. But that thing, probiotic, not only is the pathogen, but also it's a good bacteria there in the complex. In this case, so to prevent the death of good bacteria when treating with antibiotics, it is better to supplement probiotics along with antibiotics. That is use case scenario. Probiotics can correct the chance of antibiotic associated diarrhea by 60%. So you can understand the value of these probiotics. If we start them on the same day as the antibiotic, the top strings are usually probiotic use case, Saccharomyces boulardii. And Lactobacillus rhamnosus these may be new to you, all these strange names and all, like that, these networks, rhamnosus, Saccharomyces boulardii, and all these are, prominent probiotic bacteria. And in fact, Lactobacillus rhamnosus FDA itself regulates that as well as this kind of products. Whatever it says to associate along with antibiotics, to co-associate along with antibiotics, FDA itself recognizes that practice. This is simple protocol. Start progressing the same day as antibiotics and continue to practice 1 to 2 weeks after 4 cycles. The dosage will be from 50 to 100 million bodily common units. We call it as CFUs per day. Like something weeks. And there is no success rate of reducing bacterial or the stool, number of stools, bowel movements will reduce by 60%. So it does reduces the diarrhea episodes also. recurrent clostridial infection, we use Acronis Golari together with the antibiotic transformation reduction. The dosage is over 100 to 500 within the day. It brings the reference rate down by 40% to 15%. See the difference. The recurrence rate will get reduced from 40% to 15%. This is a major achievement. Now we come to immunosystem applications and respiratory applications. Go to the slide number 7. Immune system applications. Moving into immunity, especially access for claims plays a vital role. Proteins can reduce the cholesterol activity by 50% and may shorten the relapse for 1 to 2 days. Respiration, lactobacillus tuberculosis and neurovascular pneumonitis. To avoid the IgA in respiratory lining, boosting the natural killer cells and strengthening tight junction prevention. So, this is the way how we work in respiratory infections. Prevention usually remains at 20 million cases daily with the high risk seasons. During an active infection, we need 6 to 20 to 15 minutes. Initially, we start with 10 to 20 minutes. The risk is a little bit higher when the infection rate is more, then we'll go up to 50 million for a minimum 3 to 6 months. But this is especially used for healthcare workers who, paramedics, who are in contact with these patients all the time. Paramedics are the school children, because they are together, and one guy was running to spread the entire. Usually they are compromised. So let it be as security. And anyone with low immunity can slide number 8, you have immunosystem applications like allergy diseases. Go to the slide number 8. Probiotics help with allergy to a balance pH1 and pH2 response. In allergy rhinitis, the reduced symptoms during pollen season, like when they might have accident logo. At that point of time, when you contact with regulators, rhinitis, when you start with 10 to 20 million CFU on daily basis for at least 4 to 6 weeks before the season begins. For food allergies, they help the body to develop better oral tolerance that is regularly in that. Overall, the patient shows competing for 90% better tolerance to allergy foods. So, along I practice taking probiotic on a regular basis to help you to have fever, allergy diagnosis episode that any kind of allergies on the body cell. You will have a better tolerance. How it does, it is going to increase the number of regulatory T cells in you have. So you will get better tolerance to allergy food source. Please go to the slide number 9, sir. So here you will see immunosystem applications, especially immunocompromised patients. A then HIV and AIDS patients, the probate restores damaged blood flow. They reduce the opportunity infection, and we usually give 50 to 100 million due life. In this case, for HIV or AIDS patient, two strains, you can say, Bifidobacterium globulum and Picarilobacterium. Personally, these are the good, strains to select. Cancer patients, they improve the tolerance to chemotherapy. So, when you are taking chemotherapy, around and supplementation is what will also support the immune system in humans. In this case, especially, what I'm talking about is chemotherapy cancer. The dosage usually around 50 billion injections. This dosage increases the treatment phase. Here the bacteria, they connect properly. You must select the bacteria open and Calibacterium. So these two are the strains of threats. And depending upon the patient, we can adjust dosage according to the treatment phase and talking about chemotherapy. It is go to slide number 10, where I mentioned about metabolic application. It is type 2. Government is also in metabolic diseases. Because they improve blood sugar control, NHS has how they do it is by strengthening the barrier. Government helps you without definitely and ulcers so they are and by reducing their obesity and producing fats and fatty acids, especially in the best strains suitable for this kind of type 2 diabetes are Eclampsia, Muciniphila, Acinetobacterium, Pursuing, and Bifidobacterium bifidum. They should be given in 10 to 50 billion CFUs diet for around 8 to 60 days. The patient see 10 to 25% better fasting glucose and 0.3 to 0.8% of their HbA1c level. And they usually have lower inflammation when combined with the OSDs normally type 2 diabetes medicines when combined with these special strains like Echinacea, Muciniphila, Calibacterium, and Bifidobacterium. Given tested in community on daily basis for about 18 to 8 to 16 days. There will be a reduction of 25% better fasting glucose levels and they are around 0.3 to 0.8% drop in HbA1c levels. And they lower inflammation also. And if you see the application, especially cardiovascular health and cholesterol management, in the slide 11, I explained that. For heart health, probiotics lower hereditary low density cholesterol by 5 to 50%, and reduce blood pressure by 2 to 4. They do this through bile salt hydrolyzed activity and short chain fatty acids. It will start taking fantasy. And one more activity is why salt hydrolysis activity. The hydrolysis why salt. Then technically, alien will start by 15%. And that's the way the vectors will be 4 mmR. In this case, strains like Lactobacillus plantarum and Bifidobacter within longer. These are used at 10 to 20 million CFS daily usage, about 8 to 12 years. You will see the total cholesterol drop at 5 to 10%, especially LDL drop by 5 to 15%, and triglycerides by 5 to 40%. This is the usability of COVID, especially in cardiovascular and in cholesterol. We go to this slide, I explained something about the usage of this probiotics in obesity and weight management. In obesity, is that a probiotic shift to gut flora towards a lean protein, a lean fat. When people lose extra to 4 kilograms or 12 weeks compared to that, the diet management is so hard. Language, if you can provide certain type of program, try to explain what are the key stages that are required, especially for weight management for that matter. The key stages will be echinacea, Zingula, and stem cellula, meninoma. These two are the principal factors in obesity, weight management scenario. You will say when a dose is around 10 to 20 billion, CFUs daily, minimum 12. Actually, how they add these the foods that I can reduce calories or body exhaustion. That's the way how they actually work. And in slide 3, you can see the neuropsychiatric application of psychoactive in the brain axis. Nowadays, brain axis is talk to the word. Go to the slide 13. Now, actually, this is the exciting new area. The gut brain axis, probiotics or psychobiotics are used for mood and memory. Especially, depression and anxiety, these are the main neuropsychiatric issues. So, in depression, anxiety, Lactobacillus plantarum, and Bifidobacterium pyogenes, these are described. Can be used at 15 billion stations day, like 12 years. You 20 to 30%, 35%, 35% improvement in symptoms. And also 15 to 30% reduction in anxiety. They even make SSRIs work better. Serotonin reactivity. Those psychotic approach usually prescribed by psychotics. They were better to supplement with lactobacillus pyogenes and bifidobacterium, especially in depressive psychosis and anxiety disorders. And in the case of memory and cognition improvement, there are benefits by starting these two strains after 6 to 8 weeks with 10 to 20 million. You continue this one 10 to 50 million by 8 to 12 weeks. You can reduce 35% in the symptoms and 50 to 30% reduction in anxiety. Afterwards, if at all, if you want to improve upon the memory and cognitive functions, you can restart again after 6 to 8 weeks. You can give a 10 to 20 million use of dosage. These two strains like Lactobacillus annosus and Bifidobacillus dormiens. This is where we have neuropsychiatric contributions. In the slide over 14, I mentioned something about skin and health applications. Over the 14th, and skin and health applications, what we usual things are, these are very common things that we observe, like adopted relatives. So in these conditions, probably is very stable too. And actually, the reduced aging by around 50%, systemic immune modulation. Oral probiotics was better than three, so better you take oral probiotics than going for any kind of things. Here the strains that we use for technique and metabolism are lactobacillus and bifidobacterium. And 10 to 20 million cases or 8 to 12 years. For atopic dermatitis, eosinophil is nothing but eczema. 30 to 50% of the patients improve a lot. And lactobacillus annosus and bifidobacterium they are the best. These two strains are the best, especially in eczema cases. What are they? Lactobacillus annosus and bifidobacterium breve. These are the two strains which are the best for atopic dermatitis. They can reduce 30 to 50% of the patients and they improve a lot, especially in eczema cases. If in the case of baby, you can start with 4 weeks of it and continue for first year. In older children and adults, 10 to 50 million cases or 8 to 60 weeks gives dramatic results. These are the uses, especially skin and health. Actually, especially acne and here, remember these randomness, bifidobacterium. These are the two things. Which will be true. We'll go to slide 15, where application of these probiotics, especially in viral infections and therapy. Finally, probiotics support us during viral infection, especially in COVID-19 cases, there, along with this like Himalayan mushroom factory that it can be desired. That is known as audit, better. Along with audit, you can give classes probiotics. Results are so good. That was observed in our NIT Warangal has done and the trials there in better results. In the safety line, where the detection of CRP is 35%. Anybody wants to share one of those videos or some videos, you can, maybe, text me on WhatsApp. Please read about the 778. You can take from that GI. Finally, the program is supported with very COVID-19 and other safety viruses also. The CRP reduces the and shorten recovery time too. What kind of studies we have to do, especially in that kind of retailings and cleaning this very virus type of virus and harmful those kind of stuff. Okay. Uh, the second thing looking to be lactobacillus plantar and vibrio animals. These two who are the best to prevent the dosage in the of 10 to 20 years very limited. 20 10 40 years as a prophylactic using typically 100 million hours, 200 million hours. And 10 months. Rotavirus diarrhea, which is very common in children. Lactobacillus rhamnosus reduces diarrhea during duration of the diarrhea will get reduced by half in just 1 day. To give lactobacillus rhamnosus, the rotavirus diarrhea in 10 to 20 million CFOs. Per day, very resource that will be reduced by half in the first 1 day. It will be continued for 5 to 7 days by giving 10 to 20 million. That brings us to the end of today's video. Rapid progress more on the they have written evidence-based tools and pharmacy. So the gut, immune, metabolic, brain, skin, and body conditions. The key is to choose the right things, right dose, and the right duration. Always with greatest clinical guidelines. Thank you so much for your attention and taking questions. Thank you.
Thank you so much, sir. Madam Professor, sir, thank you so much for this enlightening role. Because many of the students are new for this probiotics. And thank you very much for sharing because your time is very, very precious. Also, you are busy. And you have shared for us for the students, for knowledgeable students, almost about 25 minutes. Thank you so much once again. Okay, sir. We clap for Thank you, sir. Thank you so much. We have the next speaker for the event. Next speaker for the second topic today, Mr. Veer Vasant Narvekar. Mr. Veer Vasant Narvekar and myself, we are together, we work for 18 years. 18 years we work together. 18, we are together in our journey of industry. So he is an BSc and MSc in microbiology. He has got industry experience of 42 years in industry experience. And his highest position and last position was in senior business development manager in Mumbai of Pharmaceuticals. And we started our journey together in USP, Grit, Aristo, Alchem, as well as then we started with Sai Agarwal Private Limited, Chennai-based company, and his last company was Medrai, where he worked as a deputy general manager for especially this field of industry. And he also worked in academics in ICSE school as a chief administrative manager for almost 5 years in Mumbai. And currently, Mr. Milind is working as chief executive officer with Dr. Balake GT Memorial Hospital and ICU in Nagpur. So, he will give a live presentation, especially on concern to clinical practice and prescription analysis. And now, Mr. Milind is also looking after the operations of public hospital administrations and pharmacy operations. Mr. Milind, we will share this slide and you can start the presentation. Mr. Milind. Last five minutes, correct? Give up. Mr. Milind, can you see? Mr. Milind. Mr. Milind.
Yes, good morning. Good morning, sir.
Start again. Thank you so much.
Yes, thank you so much. Good morning, all, and I am very thankful to Professor Dr. Amdesh, Deepa ma'am, and Mr. Jayasingh sir for giving me this opportunity to speak to you. Thank you so much. So, my topic is the role of clinical pharmacists in reading and functioning the prescription. Can we go to the next slide? Now, when you go as a clinical pharmacist receive a prescription, what you have to see the doctor's prescription. So let us understand what is a prescription. A prescription is a formal order of a licensed healthcare provider that is a doctor or a dentist to the pharmacist. Detailing the specific medications, procedures, and the instructions for the patient. It is essentially therefore a guide for the selected, ensuring a safe and correct distribution and usage of the drug. So, when you see when you get the doctor's prescription, you will understand this. So, can we go to the next slide? Now, this is very important. So, can we just see the prescription? Next slide.
Next slide.
Yes. Now, from here you can see the prescription looks like this. The name of the doctor, the name of the doctor, the name of the patient, then the diagnosis and the rest of this. So, can you go back to the slide? Yes. Look, as you see in the procedure, you will see the doctor's name, the qualification, the registration number given by the here. Here, the doctors give the registration number and the product. That's okay. Then there's a patient's information, patient's name, age, and gender. Then the diagnosis and the case of hypertension, the case of asthma, or whatever. Then the doctors give medication details. Then the regimen of the treatment given to the patient is rank and is finished. And there is also mention of any investigation, as the pathological investigation of the regular investigation. That is also very specified. Then there are certain instructions for the dosage. In HPLC doses, there's a OD or PID or DDS or QID and the nutrition as well. For 5 days, 8 days, or keeping it for a while, or like one. And in this statement, patients test information that is not also helpfully the document from the stop smoking and to reduce the salt and sugar intake. The patient is diabetic or diagnosed. Then the doctor also mentioned the dispensing quantity, that is 30 tablets per 5 tablets, 6 7 recommendation. And the prescription is not complete without the signature of the doctor and the date. Now, just a note here, a lot of people understand, and for the enhanced procedure, this is not only procedure, and there should be a medical reps, and you are doing what the procedure. The original procedure is must. Next slide, please. Yeah. Now, again, I think, I'm saying that there is a little advantage for the patient from CBC, CRP, and IGE levels, and also PFO. The doctor has given a specific information, or rather, to stop the practical plan. Now, this is my own decision. So I can ask from the chairman and Dr. A. If you go back to the previous slide, then you can correlate the symptoms and the physical view. The same go back to the previous slide. Like for hypertension, the SOS is given